we're going to talk about something called alcoholic liver disease, or ALD for short. Now, this is one of the biggest causes of chronic liver disease all over the world, and it all stems from something that is, at its heart, totally preventable: long-term excessive drinking. So just look at this. On one side, you have a healthy, smooth, functioning liver. On the other, you have one that's been scarred and is failing from something called cirrhosis. So the big question is, how on earth does one of the body's absolute workhorses get from point A to point B? Well, let's trace that journey. All right, to really get a handle on the damage, you first have to appreciate the incredible machine that's under attack. I want you to think of your liver as the main chemical processing plant for your entire body.
I mean, it is an absolute powerhouse. It's filtering out toxins, helping you digest your food, storing up energy for later, and making proteins that you absolutely need for things like, making your blood clot. Literally everything you eat or drink gets processed right here. And unfortunately, that includes alcohol.
Now here's the problem. When your liver goes to work on alcohol, it's not a clean process. It creates this really nasty byproduct called acetaldehyde. And if that name sounds a little familiar, it's actually one of the main things that gives you a hangover. But inside your liver, it's doing a lot more than just giving you a headache. It is a straight-up poison to your liver cells. And this one chemical, it just unleashes this whole cascade of damage. It directly harms the liver cells, it kicks up this storm of inflammation, and this is so important, it signals these special cells to start laying down tough, fibrous scar tissue. That process is called fibrosis, and it's the very beginning of the liver's downfall.
But, the damage doesn't happen all at once. The liver actually sends out a warning signal first. And this is the point where the story can have a completely different and much, much happier ending.
Okay, so this first warning sign is a condition called alcoholic fatty liver. The medical term for it is steatosis. Basically, the liver is working so hard to process alcohol that it kind of messes up its ability to handle fats. So what happens? These tiny little droplets of fat start building up inside the liver cells, and it makes the whole organ swell up. Now, the really tricky part here is that more than 90% of heavy drinkers get this, but most of them have zero symptoms. They feel totally fine. But this right here, this is that critical fork in the road. Because at this point, the damage isn't permanent yet. And this is probably the single most important thing to know about this early stage. If you stop drinking, the liver has this incredible ability to heal itself. The fat just vanishes, and the organ can go right back to normal. It is literally a biological get-out-of-jail-free card. But that get-out-of-jail-free card, it has an expiration date. If the drinking continues and that first warning isn't heard, the damage starts to escalate. And it crosses a line from being a reversible problem to a much more dangerous and, potentially permanent crisis. So the next stage is something called alcoholic hepatitis. Now, don't get this confused with viral hepatitis, like hepatitis C. This isn't an infection you catch. This is a direct, toxic, inflammatory injury caused by the alcohol itself. The liver isn't just fatty anymore, it is now actively and aggressively inflamed. And this is a really, really serious condition. People can suddenly develop jaundice, that yellowing of the skin and eyes, along with fever and pain in their abdomen. And for people who get a severe case of this, the risk of dying within just a few months is, frankly, terrifyingly high. And all of that, it leads us to the final stop on this journey: alcoholic cirrhosis. This is pretty much the endgame of chronic liver injury from alcohol. So what is cirrhosis? Well, it's what happens when the inflammation and damage have just been so relentless for so long that the liver's whole structure is permanently wrecked. Healthy functioning tissue gets replaced by thick bands of scar tissue and these lumpy nodules. The liver itself becomes hard, it shrinks, and it just can't do its job anymore. And this damage, it's permanent. So let's just quickly recap that whole journey. It starts with a healthy liver, which then becomes fatty, but it can still heal. If the attack keeps up, it gets inflamed with hepatitis. And then finally, it progresses to cirrhosis, where the damage can't be undone. It's a devastating path for sure, but the key thing to remember is that it all starts from a place that's preventable. So far, we've been talking about what's happening inside the liver. But when an organ this important starts to fail, believe me, the rest of the body knows it. The signs start to show up on the outside. One of the most classic signs is something called edema.
See, when the liver can't make enough of a protein called albumin, which is what helps keep fluid inside your blood vessels, that fluid starts to leak out into the tissues. And that causes some pretty major swelling, especially in the legs and feet.
And it definitely doesn't stop there. There's the jaundice we talked about, a huge buildup of fluid in the belly called ascites, just profound, crushing fatigue, and a lot of muscle wasting as the body just struggles to get the protein it needs. All of these are signals that the body's main processing plant is in catastrophic failure.
Doctors also have a really specific clue they look for in your blood work. Think of these two liver enzymes, AST and ALT, as two different fire alarms. In most liver problems, the ALT alarm is the one that's ringing loudest. But with alcohol damage, the pattern flips. The AST alarm is often at least twice as loud as the ALT. That specific ratio is like a fingerprint that points right to alcohol as the culprit.
Now, despite how grim the later stages sound, the story doesn't have to end there. For a lot of people, there is a path forward. But it's a path that has a very, very clear and absolutely non-negotiable starting point.
This is it. This is the single most effective, most important intervention in all of alcoholic liver disease. Complete and total abstinence from alcohol. It is the foundation that everything else is built on. If you don't do this, nothing else is going to work.
So, managing the disease is kind of a three-pronged attack. First, like we just said, you have to stop the alcohol. Second, you have to aggressively fix the severe malnutrition that almost always comes with this disease. We're talking a high-calorie diet, lots of vitamins, especially one called thiamine. And third, you use specific medical treatments like steroids to manage the really acute, dangerous flare-ups. And finally, for people whose liver is just damaged beyond any hope of repair, a transplant can be a life-saving option. But listen, it is not an easy fix. It's a massive surgery, and it's reserved for patients who have already shown that they can stay sober for a long time, proving they're committed to protecting that new, precious organ.
And so that brings us right back to where we started. We've seen the whole spectrum, from a silent, completely reversible warning sign all the way to a final, irreversible failure. The biggest takeaway here is that that first stage is completely fixable. So the ultimate question this leaves us with isn't just about medicine, it's about choice. How can we use that first warning sign as the opportunity it is to prevent ever having to reach the last one?